pretty, straightforward, unvaccinated, COVID positive patient with only single organ dysfunction, who seems to be holding his own on.
The last 2+ years has been a lot of different phases, a lot of different ups and downs.
His wife came to visit. He seems to be in good spirits.
Okay, good. And a lot of different challenges. And I think where we are now is in a situation with more COVID positive people in the area than we've ever seen. I will go in and talk to them. And we're faced with a potential to fracture our main strength, and that's the people that work here.
Andrea's been taking care of you. Yeah, you know her very well.
We have more patients today in a hospital that we've had at any other given point in time during this entire almost 2 years that we've been dealing with this pandemic. So just to give you an idea, right prior to Thanksgiving, we were averaging about 7 to 8 COVID patients a day. Now we're in the upper 80s. So a 10, 11-fold increase in just a few short weeks.
We're all rooting for you.
In our hospital, 70% of the patients that are admitted for COVID-19 are unvaccinated. An even higher percentage of those have severe illness, making it to the ICU. And over 90% of those who die were unvaccinated.
Had I got the shot, maybe I wouldn't even be in here.
Yeah.
But I know one thing. I don't have it as bad as a lot of other people in here. I do understand that.
That's right.
But the bottom line is, I believe that we need to get this shot.
Yeah.
And as soon as I'm able, trust and believe, I'm going to be the first one.
If you don't have to go through some bad stuff, why? Why go through it?
Yeah. Appreciate this.
You hang in there, man.
And of the ones who are vaccinated, almost all of them have some type of comorbidity or they're immunocompromised. We see very few patients who are fully vaccinated and boosted ending up in the hospital.
So this is like one of these things where, it's not catastrophic COVID, it's COVID that sets the dominoes,
It's not COVID ARDS.
Right.
It's the other things.
It's the ripple effect, correct.
Well, it's overwhelming. It's completely overwhelming because I kind of feel like in a lot of ways we are where we were when COVID first came. The big influx of patients, how we have to change how we do patient assignments. They come a lot of times and they're admitted to the floor, but when they get really sick, they have to come to ICU.
I don't know what the sequence of events was. He came in bad shape and only went in worse shape, unfortunately.
I came in because I knew I had pneumonia. I could feel it. I couldn't stop coughing, and they took the COVID test and they came back and told me I had it. So because of my heart condition, they decided to keep me. I've had both shots. I was due to get my booster the end of this month, so I have to wait now, at least till next month. But I'm going to get it. No, my body fought it off pretty good. The vaccine really do work. If I did not get vaccinated or I did not come here, I may not be here to talk to you. I may not be here.
Last week I had a patient and we had to intubate him. And as we were kind of gathering equipment, Dr. Patel says we're gonna do our rounds first and then we're gonna come back. I think he needs to be intubated. I said, okay, fine. So I went in and I talked to him, and it's scary to see all these people come in the room with masks and goggles and all dressed up. And he looked at me and said, I am trusting you to take care of me. And it just rips your heart apart. Unfortunately, he didn't make it. And how does that make me feel? I kind of feel like I failed him. But also I wanted to say,
How are you doing?
If you've only gotten the vaccine, I wish you had gotten the vaccine.
I know it's scary to get that call in the middle of the night, though.
The beginnings of this were everyone inside the hospitals fearing for their own lives in the quest to help others. Everyone in the hospital dealt with lack of PPE, lack of testing, healthcare narratives rooted in political nonsense, a new antagonistic relationship with the patients because of belief in lies and a lack of respect for scientific fact. And then, all that on top of the death, right? The volumes of death. And you put any workforce through that, and it's not going to be whole, right? And we're far from whole right now. But when you intubated him, it was clear that he aspirated at least. So.
Just like every other industry, healthcare, we've had the same kind of issues of the great resignation, the great quit, whatever we're calling it these days. And a lot of that, I would say, is because it's hard being a healthcare worker. It's been almost 2 years, and there are so many people who are dedicated and have been dedicated to the field, but they're just drained, tired, and trying to figure out how to juggle everything else in their lives. So we have seen, in some departments up to a 20+% vacancy rate, which makes it very hard to staff at the same time that volumes are going up.
I hate these gowns, man.
We also, we live in the community, the same communities that we're serving. So in the last few weeks, about 50 to 60 staff who have tested positive for COVID. So that just puts an additional strain on our ability to take care of the community.
I don't know. Was she ever extubated? A lot more is being shouldered by fewer people. A lot of times, in a lot of industries and a lot of businesses, people can perceive people and workers to be replaceable. Look around at these people here. They're not replaceable. What drives them is not something you can duplicate. It's who they are. Deal with chronic illness all the time, right? It's just a matter of you add COVID on top of that, and it sets the ball rolling to this. So yeah.
I never thought about quitting. It serves my life's purpose. I love helping people. And it's being a nurse is sort of like being married. You come for the good and the bad. And COVID was definitely the bad, but I still came to work because why quit now? My patients need me.
We totally need
A win?
Yeah.
Yeah.
So him getting out of here will go a long way.
I need a win.
I know.
So let's do it.
The odds are against them and us, and you're just setting yourself up for so much disappointment, and that's what's been very, very hard. And each time you get a glimmer of that, that hope that you can get someone through it, everyone here is rooting for him, so that's what we have left.
Okay. At some point, yeah. I mean, like, when are you hoping to do it?